If you or someone you love are considering a joint replacement but have been reluctant maybe for getting it done, our next guest has some good news to share. Joining us today is Dr. Stephen Lucie, orthopedic surgeon with Jacksonville Orthopedic Institute. Welcome to the show, Dr. Lucie. It's good to see you again.
Good to be here.
We worked together way back in the 90s and through my time with the Jags. And again, I don't mean it, no offense. I'm glad I never got to come to your office.
But a surprising development for all the stunts you did during that period of time. But youth is a wonderful thing sometimes.
Very, very true. For those out there thinking about hip or knee pain, and they may need thinking about their hip or knee pain and a replacement, what's new in total joint replacement in 2015 that may help them?
You know, a lot of neat stuff going on. You knew me as sports medicine. I still do a lot of sports medicine, but some of my sports medicine patients are getting a little older. My weekend warriors are starting to need a joint replacement. They're just as demanding as it when they wanted to get back on the tennis court or playing golf. And so the orthopedic field has responded, and I guess just in the past year, we've gone from people staying in the hospital 3 or 4 days and going to rehab centers. Now we got people up the same day of surgery. A lot of them go home the next day. I think in the future we might be doing them as outpatients.
Wow.
But we're seeing people now doing better in 2 weeks than they used to do in 2 months.
Yeah, I mean, we've seen it across sports too, but the recovery time is getting so much faster. And what are the reasons for that?
Well, a lot of it with the total joints has to do with pain control and our anesthesia. The anesthesiologists for our knees are doing some long-acting blocks that give the patients pain relief for the first 12 to 14 hours, but don't make them weak. We've got some new Novocaine. It's a slow-release Novocaine that lasts 72 hours. And so if people are more comfortable, they'll get up and move. And so once they get going, then they go, you know, I can do this.
Yeah.
And then they're ready to go home because, let's face it, the hospital food isn't the best in the world. They want to get out of there.
And without that pain, the body is healing a little faster, and they feel like they can have more movement with it.
Absolutely.
So we were talking about robotic. You're using robots in there. This is pretty cool. We have a video here, and it's robotic joint replacement, and you actually directing the robot. What's this all about? Well,
we've been doing this at Baptist for about 3 years. This is our version of the R2-D2.
Yeah.
I hadn't seen the new one with the new Star Wars, but this device enables us to precisely place implants perfectly every time. That's a burr, and you can see it preparing the bone for the implant, and it is pre-prepared, pre-planned, but it will not allow me to make a mistake. It puts it in perfectly every time, because I'm driving it, but it's like staying in exactly the pre-programmed parts. And these total joints, this shows a partial replacement. It's just resurfacing, like retreading tires. On this side, we're resurfacing the inside of the knee, and it restores a normal motion. And in the end, it feels pretty normal.
Yeah, that is really, really cool. So it won't let you, so in case you get to the edge of the kind of perimeter it already set, it won't let you go past that.
It stops.
Wow.
It will not go deeper. It will not go outside of the parameters. And you're watching on a screen and watching the patient, but it's showing you where to go and how deep, and it won't let you make a mistake.
It has to obviously makes it way more precise, and you have less damage to stuff you didn't have to damage. Obviously helps with the pain.
It definitely does, and the longevity. People want to know how long these things last. Well, if you put them in very well, they're going to last longer, and that only makes sense.
And so hip replacement. Our friend Tony Baselli, he had both his done. What's anterior total hip replacement? What's this?
Well, you see a lot about that, and it's another thing that's enabled us to rehab patients faster. Small incision, not cutting muscles. It's not for everybody, but for those people that it is, enables them to get up, get going again. They're walking the same day or the next day, and they're improved, and it's a little more stable. It's not for everybody. Some people still benefit from the time-honored total hip that we've always done, which is also a great operation.
And for those out there who may have already seen you or are thinking about joint replacement as an option, and they have some concerns, what do you have to tell them?
Well, I think the main thing is it's not as scary as it used to be. It doesn't hurt as much as it used to hurt. You get over it faster, and these are really good operations. So if you're suffering, don't suffer.
Appreciate the information, and we'll catch up on some more Coughlin stories. We were catching up on getting called to the principal's office back in the day. I'm sure you don't miss that. being out of sports. It was a great time.
I'm still very involved, but I can assure you there was only one Tom Coughlin.
That's absolutely right. He's a great man. We'd like to thank the Jacksonville Orthopedic Institute for sponsoring this segment, and for more information, visit joi.net or call 904-JOI-2000.